Hello everyone, we have Dr. Megan, who is an international medical graduate from Iran. Recently she passed her AMC clinical. I think it's a great story. When I read comments or posts in Facebook, I see lots of negativity and lots of people who are not happy with the system, not happy with the exam, not happy with the country. I always feel like, man, there should be something better, so when I see some success stories or when I see people who have cracked the exam despite all the struggles they go through, I wanted to tell people that if you practice for this exam in a proper way, you will be successful. It's not like a rocket science exam. All it is there are certain things you have to follow. Unfortunately, what I've seen is people learn from doctors who are not even qualified to teach you guys, and they fail the exam because these doctors who are actually teaching you never saw an Australian patient, never worked in the Australian healthcare system, and they teach you because you are desperate, you are frustrated, you don't know what to do, and you are looking for a cheap way of learning and getting over medicine. So that is, someone's opportunity there. So I feel like there should be a better way of doing things. I'm not trying to sell anything here. I just want to provide value. And again, I want to give a conflict of interest here. Yes, I used to do some teaching. I'm not doing teaching anymore because I'm busy with clinic and practice. Yes, I wanted to come back and do some training and courses because I see that there are a lot of people who are actually taking advantage of international medical graduates situation, like some providers charging thousands of dollars. So that's the reason I wanted to come back. I wanted to provide some value, some motivation by interviewing Dr. Megan, because who is an IMG like you, IMG like me, and she has cracked this AMC clinical exam, which is one of the very challenging exam. So without wasting too much time, I will ask Dr. Megan about her mindset, and I will do a series of videos because it's easy for me to upload them and share them, and I will be posting them in all AMC clinical groups. So hopefully you will learn from this, get motivation from this, and achieve success, smash the exam and be a good doctor. Be positive, stop thinking with a small mind. I want you to be successful. If you are having any doubt, feel free to send me a personal message or actually post in the group. If I'm having time, sometimes I just go and check some messages and I'm happy to answer, or I might even do a video because a lot of students might have the same doubt. So let's not waste any time. Dr. Megan is here. First of all, Megan, congratulations. So I want you to talk about your mindset before the AMC exam. When you were preparing, what was your mindset? Were you positive? Were you confident that you will pass the exam? Be as open and honest as possible. We are not, doing anything with this. We are just trying to provide value to someone who was like you, who was like me. I want them to understand that it's a doable exam, but you need to use the right approach. So be open. There is no right or wrong here. You passed, that's a success story. So Tell me, what was your mindset before you went for the exam? Not like couple of days before, when you booked for your exam. What were you thinking? Will you pass the first time? What is your mindset?
Okay, first of all, thanks from Dr. Talari. The last 2 months, he was actually one of the person helping me a lot. I've learned a lot from him. I will tell you a bit later. But for my mindset, I think when I booked the exam, I didn't book to pass the exam, booked to study and learn, to think that if I have real patient, what I will do with that patient. I didn't think that if this is going to be exam just for first time. Okay, you may pass the exam. So what about later? If you miss something, okay, you will be in more trouble. So I wanted to really learn deeply. That's why I put my mindset on that. For example, if I'm going to read about a topic like abdominal pain, to know about everything, what causing, what about all the diseases. I went through everything and tried to read and study all the material, about abdominal pain.
Good. So you are doing more in-depth reading, trying to understand it as what will happen if I be a doctor rather than I want to go and pass the exam.
Exactly.
So your end goal was to be a good doctor.
That.
That is exactly what I used to think. That's one thing, I thought people should know. When I was talking to you, I got that same feeling. So that's why I thought the world should know, because it's a mindset.
Yes.
Everyone who passed, like exam overseas came here. We all have more or less similar knowledge. Sometimes when I'm doing workshops with medical students or with IMGs, some of them are so clever. I feel like, man, this guy, I know 1/10 of, this person's knowledge. So it's not the knowledge, it's the technique, it's the strategy, it's the frameworks, it's your approach, your mindset.
Yes, I think if you know about, if your knowledge is deep and you know about everything, then you will be confident.
Yep.
Then okay, if any cases in abdominal pain, then I am as a doctor confident to treat that patient and pass that station as well.
Yep. So that was the mindset before. So you never thought of pass or fail, in other words.
Exactly.
And coming a bit of background, Dr. Megan passed her pesky. She started working with us almost 2 months ago, and I am her supervisor. So I was helping her with minor things like practical things, but we never got a chance to do role play because it's winter months and I'm crazily busy. So I never got a chance. Ideally, I love to do role plays with Dr. Megan, but I couldn't help her. But coming to that, so now I want to go back to your role play thing, which is something I couldn't believe. Yep.
But something, we didn't have time actually to do role play, but whenever I actually ask you about patient
Yes,
as a
yes.
supervisor, for example, okay, this patient here with this skin lesion or anything, during even 1 minute, Dr. Talari had the time to explain briefly his, and trying to extend his actually practice knowledge, and that I would say that was extremely helpful.
Okay, that's
Yeah.
good. That's good. No, but coming back to role plays, because this is something someone in the group asked me initially after you came from the exam. You said, "Doctor, this was the case, this was the case, this was the case," and you were never confident. So when you said that, I thought, man, maybe Megan will fail. The reason I thought you will fail is I asked you, how many role plays did you do? And you said, "Doctor, I didn't do a single role play." So tell me about that.
Honestly, because I am a mother of two naughty boys, and I don't have time to actually do role play with anyone, because I had to come here during day and also in the afternoon take the kids to sport, cooking, cleaning, everything, and then night and next morning. So what I did, I just created cases for myself, and during driving back and forth in the road, I just talked to them, to myself, role playing with self.
Yep.
Even sometimes as a doctor, creating more difficult.
So
condition.
can you give an example? Let's say a 4-year-old child has come with rash. How would you do it with yourself? Because this is something I thought you will fail, is not because you didn't have knowledge or anything. I thought, man, she didn't do a single role play with anyone. How can someone pass? Because every time I teach someone or I talk to someone, I tell them you should do 1,000 role plays. Okay? This is why I thought the world should know about your story, because without doing a single role play with a study partner, because that's one thing when I do workshops for IMGs I did a lot of workshops with Indian Medical Association, Pakistani Medical Association, Bangladeshi Medical Association. So I used to talk to people a lot because that's something I was very passionate many years ago. And people said, "Dr. Talari, I don't have a good study partner." But now you proved that it's wrong. You don't need a study partner. So just walk me through this process. How do you do role play? Because that's something even I want to know. That's why I left this question. I didn't ask you in person because I thought you should tell on the interview. The world should know. How did you do it? Let's say if you were thinking about a 4-year-old child with a rash, how would you do a role play with yourself?
Okay, something I would like to tell first is if you can't find a good role player, maybe you yourself are not a good doctor. Okay, so you both has to be really good in this regard. But for myself, actually, this role playing, for example, this 4-year-old child with rash, I have something in my mind. Okay, with someone coming with any symptoms, I think about one of the most actually urgent and one of the commonest and one of the rare one first.
Okay.
Okay.
Yep.
And I bring in my mind those symptoms, quickly ask them, then go through those Socrates question. Okay, where is, when start, and things like this. So I have these two in my mind,
Yep.
and I ask these questions
Yep.
to be focused history taking.
Yep.
Okay.
Yep. Good.
And
So,
then
so show me an example. So let's say a child 4-year-old rash has come. How do you do a role play with yourself? So do you tell, okay, 4-year-old child has come to me with a rash. Hey, Sandra, I am Dr. Megan. How do you do
okay, I start, those questions when it start, was how it is progressive, nothing, radiating. So those questions I quickly start from the mother. When did it start? How bad it is, when was the first sight of the rash, extending to somewhere else or not, any fever, associated symptom, abdominal pain, cough, anything like this.
Yeah.
And then if I just go through different topic then later. Okay.
Yeah.
Like I'm assuming that might be measles, that might be actually anyone in the family with the same disease. Okay, if family history, those questions. So I create different scenario for myself.
Yep.
With just rash.
Yep. Oh, okay. So in the rash, you used to think this patient might have come with measles.
Yeah, might be meningitis, might be measles,
Yep.
might be this patient actually is like hemangioma. Okay, internal bleeding.
Yep.
Might be, which is rare actually.
Yeah,
but
yeah.
you have to bring
Still,
in your
yeah,
mind. Any bruise recently, epistaxis or anything, nose bleeding, or also might be just eczema.
Yep. Yeah, it can be as simple as that.
The rarest,
Yeah.
and the contagious one.
Yes. No, that's good.
Okay.
Yeah.
And then this way you can pass any stage
Exam.
cases
Yeah,
with
exactly.
this.
Yeah, because you are a safe doctor.
Yeah.
You ruled out the red flags. You ruled out the common causes, and you ruled out things like the contagious and things like that. Yep.
Okay.
No, that's good.
So you're ruling out contagious diseases, you're ruling out rare diseases,
Yep.
you're ruling out also those, with commonest diseases,
Yep.
like common skin rash.
That's a very good approach,
Okay.
actually.
So you have to, for all symptoms, I'm not just telling that about the skin
Yeah,
rash,
rash,
for all
yeah.
of them. If you cover these 3 things, I reckon you will be okay.
Good. Excellent. So that was the mindset. In the next video or next interview session, this is part 2. There will be multiple parts. I want you to listen to each and every part. And this is very interesting. I am actually excited to ask all these questions. So make sure you don't miss a single video in this series. Because I can't upload, I will do it as few parts and I will post them so everyone will benefit from it. So in the part 2, I'm going to ask about her fears and frustrations.